edition of Annie Otto's vlog. If today's your first day watching me, you are welcome. If you're a returning fan, thank you so much for coming back. I really love and appreciate you. Please like, share, and comment on my video. So in today's edition, we are zooming into health, mental health, dementia to be more specific. Dementia have been on the rise in the last decade. So some years back, dementia was generally seen in people 65 years and older, but today people at the age of 40, 45, 50, 55 are being diagnosed with dementia. Why so because of this, we need to be well equipped, we need to be well informed, we need to be able to look out for each other. So according to CDC, the Center for Disease Control and Prevention, dementia is not a specific disease, but rather a general term for the impaired ability to remember, think, or make decisions that interfere with doing everyday activity. Alzheimer's disease is the most common type of dementia. Dementia is being seen as the damages to or loss of nerve cells and their connections in the brain activity. According to CDC, women are nearly 2 times more likely to be affected by dementia and Alzheimer's disease than men. But regardless of this, women that have dementia outlive men that have dementia. What are the early signs and symptoms of dementia? Number 1, memory loss. So forgetting the names of family members, close friends, that's a ding. Getting lost in a familiar place, in a familiar neighborhood, even in your own house, you don't know your way out, in and out, there is a problem. Or even going to work, you just get lost, you keep driving past your job. I know this can happen, but if it's happening very often, you need to check yourself out. Or you're using unusual words to call certain things, or maybe familiar objects, you can't even remember the name. You're holding a key, you're calling it a cup. There is a problem. If this is happening like boom, you need to check yourself out. Another thing is attention deficit. When somebody is being unable to complete a task, whether individually or collectively, there's a problem. Being impatient, or you can't stay in a place longer than certain time, you just so anxious, nervous, you can't just keep it down. There is attention deficit going on in you. There is a problem. Another one is communication. Forgetting what you intend to say. The storyline you're telling, you just lost it. You can't just carry through. There is a problem. You can't organize your words. It's all over the place. Or you're referring to people as things or things as people. There is a problem. Another one is your reasoning, your judgment, your problem-solving skills are being affected because you can't just handle those issues the way you should handle it as adults. Then forgetting the functions of items. You have a cup in your hand, you don't even know that the cup is used for drinking. Or you have a key, you don't remember the key is being used to open something, and you're using a key to write. There is a problem. Or misplacing things very often, and you can't just retrace yourself. It's a problem. Another one is asking questions over and over and again, even when somebody is explaining in detail, giving you directions and everything, you can't just comprehend it. There is a problem. Another one is being unable to retrace your steps when you get lost. It's a biggie. So we need to be very careful when all of these are happening. We need to check ourselves out with the doctor. Go and see your doctor. If it's happening to somebody who cannot take himself or herself to the doctor, you need to give a helping hand to that person. There are so many types of dementia, but we are going to just focus on the main ones. So we have Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia. So mixed dementia has Alzheimer's disease, vascular, and Lewy body dementia. So that's why we call it mixed. So again, dementia is a progressive disease. Unfortunately, dementia is not reversible, but it's manageable. So guys, what are the causes of dementia? Number 1, age. So age-related brain cell changes can easily push somebody over the age to develop dementia. So according to CDC, 1 in every 20 people 65 years and older has dementia. So however, dementia is not age induced, but it's aging related. Number 2, genetic. That's hereditary, family history. So if somebody that is related to you in terms of your siblings, your parents, your uncles, your aunties has dementia, there is a possibility that you might develop dementia. It's not like you will, but there is a possibility. So again, it runs in the family. Some people are at greater risk of developing it than others. Number 3, Down syndrome. So by middle age, many people that have Down syndrome automatically develop dementia. That's something that is unavoidable when somebody have Down syndrome. Number 4, environmental factors. That means something that causes degeneration of the nervous system. Something like air pollution from your traffic exhaust, generator, burning wood. All these things can cause brain cell degeneration. So be careful when you burn your candles inside your house. Number 4, lifestyle factors. So if you're one of those that eat anyhow, drink anyhow, smoke anyhow, use any type of drug, be careful, because all of this can kill your brain cells. Your thinking, your memory will be zapped because of those things that you use. Other medical conditions can cause people to develop dementia. So if you have high blood pressure, high cholesterol, high blood sugar, please take care of those accordingly. Take your medications as ordered. And people who have had cardiovascular accidents, stroke, they also have been affected by it and they develop dementia along the way. Certain low levels of vitamins in our system can also result to dementia. So some medications we take can also cause somebody to develop dementia. So we need to balance everything. So that's why it's very, very important for us to always check with our doctors before we take any new medication, or check out the ones we already taken. How are we doing with it? Is it okay with us, or is causing us more harm than good? So always check with your doctor. So guys, how do we reduce the risk of developing dementia, or how do we prevent the development of dementia? Number 1, quit smoking. If you are smoking anything smokable, you need to cut it out. Please do not use illicit drugs. If you are using it already, you need to cut. Another one, please take your medications as ordered. You need to reduce your blood pressure to normal, your blood sugar, your cholesterol. Please keep it at the normal level. Be physically active, exercise, move around, use your brain, keep your brain working, read, play card, chase, play basketball, do something, use your brain, play some puzzle, okay? Don't just sit there. So challenge your brain, activate your brain constantly. Look at things that increase your brain cells to work harder. Do all those ones. Another one, get enough quality sleep. You need to sleep at least 8 hours a night. Do not sleep anything less than 6 hours. It's not good for your health. Please stay engaged. Involved in community activities, in church activities, even in your family activities. This will help you to keep going on. If you have any hearing problem, please treat your hearing so that we will be able to differentiate when you have heard and when you have not heard, so that we don't conclude you don't know what you're doing, whereas you did not even hear in the first place. So please, if you need hearing aid, put it on. Another one, have a thorough annual checkup. Go to your doctor, do lab work. Any test you're due, please get it done. So eat healthy. There are some brain foods that you need to increase the intake, such as seafood, fish. Please increase the intake. Healthy oil from coconut, from avocado, those are good. Some grains, especially wheat, those are very, very nice. Red wine, once in a while, those are good for brain cells. Nuts like walnut, peanuts, cashew nuts, all of those are brain food. Poultry, egg, white meat, those are good for your brain. So go for it. Fruits and vegetables, legumes, beans, those are very good quality brain food. Avoid loneliness. Avoid loneliness. Make some new good friends. Go to activities. Don't just lock yourself down in the room all by yourself in your house. Your brain cell is going to degenerate if you keep being lonely. If you are depressed, treat your depression, treat your anxiety. All these things will help your brain to perform, to function better. These are the ways that you will help yourself escape dementia or to prolong the effect of dementia. How do we treat dementia? Just in case somebody you love, your spouse, your parents, your siblings, somebody you love, your friend develop dementia, what can you do? How do you participate in taking care of somebody that have dementia? You know, treatment of dementia depends on the stage of that dementia. So that's why it's very important to go and see your doctor, have a discussion so that the doctor will know exactly how to handle your case, because each case is different from the other. The therapy rehabilitation is very, very important. So this includes physical therapy, occupational therapy, music therapy. These are very, very good for people who has dementia, because some of them have forgotten how to use their hands, how to walk, how to do so many things. So when you get them in these therapies, they will be taught again how to do certain things with their hands and how to move around safely. Number 2, medications. So cognitive enhancing medications are very, very important for patient who has dementia. So this is going to help to stimulate the brain cells and also make them remember many other things that they have forgotten, or to even act better, or to even do things better. So that's why medications are very, very important for people who has dementia. Another one is cognitive stimulation therapy, CST. So this is more like taking part in a group activity, group exercise, playing cards, telling stories, singing songs, drawing, playing with Play-Dohs, molding things, doing a lot of things in a group, participating in a group therapy. You know, it helps to stimulate the brain cells. It helps to remember, and it helps in problem solving skills and language ability. So these are very, very good for people who has dementia. One thing we shouldn't forget is about the family and caregiver support. So somebody who is taking care of someone that have dementia also needs support, because this can be emotionally draining. So you see people who has dementia, they're doing things that they are not in control of. If you're not patient enough, if you're not kind enough, if you're not loving enough, you will see yourself losing it at some point. So that's why it's good to also evaluate the family members and caregivers surrounding that person that has dementia, because they might need a break, they might need vacation, they might need some type of therapy as well. So make sure they are safe, make sure that there's nothing that will harm them, and also make sure that they don't wander off. That's why you need to put an eye on them. Also make sure that they are well fed, that they are kept tidy, and also that they exercise and do things they should be doing on spot and on time. Make sure they are happy and they take their medications as ordered, and also they go to their doctor's appointment as scheduled. So again, these are the things that we need to know about dementia. Dementia is very, very broad, but I cannot talk about the whole thing in this particular clip. Please take this very, very seriously, because we don't know who is next, and we need to be careful about what we do and what we are not doing that we're supposed to be doing. So please do not forget to like, share, and comment on my videos. I'm your girl, Annie Otter. I love you guys. Please stay safe. Bye, guys.